94% of the people who have died from coronavirus in the United States have one or more underlying health condition. This means that there are very few people who are significantly affected by COVID-19 unless they have an underlying health condition. The most common of these conditions was hypertension, which was present in 49.7, almost 50% of all deaths, followed by obesity, chronic metabolic disease like diabetes, chronic lung disease like asthma, and of course, cardiovascular disease. Well, maybe you're saying, I'm one of those people. What can I do now? How can I make a significant impact on my blood pressure quick enough to lower my risk for dying from the coronavirus? Well, it doesn't take much time. For instance, we know that in a few weeks of adopting a healthy, vegan, whole foods, low-fat diet, we can see dramatic improvements in blood pressure in just a few weeks. This is seen over and over again in the scientific literature, as well as here in the DASH study, Dietary Approaches to Stop Hypertension, which was only 8 weeks long, and immediately we see the blood pressure come down. Patients who participate in a supervised water fasting program like ours will decrease the blood pressure 30 to 60 points on average, normalizing the blood pressure in about 2 weeks, eliminating the need for medications, as seen here in this JMPT study from the year 2000. Virtual consults at Back to the Garden are available for anyone from any country. If you are interested in getting in touch with us, find out how you can benefit from a health program, call or email us, visit the website backtothegardenpr.com. What about diabetes? Well, in just 3 weeks, we typically see HbA1c, or glycosylated hemoglobin, decrease a full point. Here is an example from a patient this month. As you can see, the normal range is from 4.3 to 5.8. This patient decreased his HbA1c from 7.1 to 6.1 in just a few weeks, reversing his diabetes and getting those numbers almost back within the normal range. It doesn't take much time when we make the right changes. Asthma and autoimmune conditions also respond well to fasting and adopting a healthy diet. I mean, an excellent diet. Now is the time. But wait, does that mean if we don't have a diagnosed disease yet, we don't have to worry? Does it mean that if we don't take high blood pressure medications or insulin for our diabetes, we are in the clear? It is safe to assume that the young, healthy population is not so healthy after all. 40% of the population between the ages of 20 and 30 are obese. 50% of children ages 2 to 15 have fatty streaks in the coronary arteries, the first stages of atherosclerosis. You may not have been diagnosed with high blood pressure or diabetes or cancer yet, because these diseases take decades to develop. But we certainly can't call our young population healthy. Don't wait until you get diagnosed to start changing your diet. If our main goal as a global community in the next few weeks and months is to reduce the number of medical resources we need to care for severe cases, keeping people out of the ICU, reducing our vulnerabilities so we don't require medical care, then we cannot ignore the effects of a poor diet. Getting rid of meat, dairy and eggs, processed foods such as flour, salts, sugars, and oils, and get on a whole foods, low-fat, plant diet.